Discussing diabetes part 2. In this part, basically I am discussing signs and symptoms, prevention and treatment, and awareness for everyone. Welcome back once again in your biology class. This is Nowsin and you are watching your most favorite channel, Educational Support. So my lovely students, are you ready for this session? So let's get started. You know that diabetes is the chronic disease marked by high level of blood sugar in the blood. In my previous video, I was already discussed diabetes part 1. So go and check it out. So what are the signs and symptoms of diabetes? The classic symptoms of untreated diabetes are weight loss, polyuria, that is increased urination, polydipsia, that is increased thirst, and polyphagia, that is increased hunger. So symptoms may develop rapidly in type 1 diabetes, and several other symptoms are headache, fatigue, slow healing of cuts, and itchy skin. So prolonged high blood glucose can cause glucose absorption in the lens of the eye, which leads to changes in its shape, resulting in vision changes. So the major long-term complications relate to damage to blood vessels, and diabetes doubles the risk of cardiovascular diseases, and about 75% of the deaths in people with diabetes are due to coronary artery diseases. So other macrovascular diseases include stroke and peripheral artery disease. The primary complications of diabetes due to damage in small blood vessels include damage to the eyes, kidneys, and nerves. Damage to the eyes is known as diabetic retinopathy. It is due to caused by damage to the blood vessels in the retina of the eye and can result in gradual vision loss and eventual blindness. So diabetes also increases the risk of having glaucoma, cataract, and other eye problems. It is recommended that people with diabetes visit an eye doctor once a year. So damage to the kidneys known as diabetic nephropathy can lead to tissue scarring, urine protein loss, and eventually chronic kidney diseases, sometimes requiring dialysis or kidney transplantation. So damage to the nerves of the body and known as diabetic neuropathy and is the most common complications of diabetes. So next we are going to discuss the treatment about diabetes. So depending on what type of diabetes, you have treatments for all type of diabetes. So eating healthy. So there's no specific diet in diabetes. So you will need to center your diet on more fruits, vegetables, lean proteins, and whole grains. Fruits, that's a high in nutrition and fiber and low in fat and calories, and cut down on saturated fats, refined carbohydrates, and sweets. In fact, it's the best eating plan for the entire family. Sugar foods are okay once in a while, as long as they are counted as part of your meal plan. Yet, understanding what and how much to eat can be a challenge. It's really very important. A registered dietitian can help you to create a meal plan that fits your health goals, food preference, and lifestyle also. So this is likely include carbohydrate counting, especially if you have type 1 diabetes or use insulin as part of your treatment. So the next treatment is physical activity. So everyone needs regular aerobic exercise. You know that. So people who have diabetes are no exception. Exercise lowers your blood sugar level by moving sugar into your cells where it's used for energy. Because choose your activities what you ever enjoy, such as walking, swimming or biking. What's most important is making physical activity part of your daily routine. Aim for at least 30 minutes or more of aerobic exercise most days of the week, or at least 150 minutes of moderate physical activity a week. If you have not been active for a while, start slowly and build up gradually. It's also a very good idea to avoid sitting for too long. Aim to get up and move if you have been sitting for more than 30 minutes. So next we are going to discuss on awareness, which is very important for all of us. So identify yourself. This is most important. Wear a tag or bracelet that says you have diabetes. Keep a glucose kit nearby in case of a low blood sugar emergency. And make sure your friends and loved ones know how to use it. This is very important. Next is regular eye exams. So your eye care specialist will check for signs and symptoms for retinal damage, cataracts and glaucoma also. Keep your vaccinations up to date. High blood sugar can weaken your immune system. You know that. So get a flu shot every year, and your doctor may recommend the pneumonia vaccine as well as. So if you are age 60 or older, have diabetes and have not previously received the vaccine, talk to your doctor about whether it's right for you. Next point is pay attention to your feet. Wash your feet daily in lukewarm water. Dry them gently, especially between the toes, moisture with lotion but not between the toes. Keep your blood pressure and cholesterol under control. So eating healthy foods and exercise regularly can go a long way toward controlling high blood pressure and cholesterol. So medications may be needed too. Take care of your teeth. Diabetes may leave you prone to more serious gum infections. Brush your teeth at least twice a day. Next awareness is stop smoke or use other types of tobacco. This is very important because smoking increasing your risk of various diabetes complications. Smokers who have diabetes are more likely to die of cardiovascular diseases than are non-smokers who have diabetes. So according to the American Diabetes Association, talk to your doctor about ways to stop smoking or to stop using other types of tobacco. Next important awareness is stop drinking alcohol. You know that alcohol can cause either high or low blood sugar depending on how much you drink and if you eat at the same time. So if you choose to drink, do so only in moderation. 1 drink a day for women and 2 drinks a day for men, and always with food. So these are the awareness about diabetes. Thank you for watching. Thank you for your attention. Make sure you hit the subscribe button and click on the bell and turn on the notification. So tata, bye bye, see you in the next video.